Okay, the use of prescription painkillers by employees, really, it's exploded over the past few years. Dr. Michael Lowenstein, you are the co-director now of the Waismann Method. You're here basically, we're explaining how addiction impacts safety, your own safety, and also the safety of your coworkers as well. Good morning, first of all.
Good morning.
Let's talk about this. The rise, we gave some stats just a few moments ago, the rise in the prescription drug use, it's really unbelievable the last couple of years. Why is that?
Well, the rise of opiate use or prescription pain medications in general has greatly increased over the past several years. Even looking at high school students, there's a marked increase in high school seniors that have had exposure to Vicodin or OxyContin. And I think in general in society there's more and more use of prescription pain medications. But Quest Diagnostics that does drug screening for the workplace, they've showed between 2008 and 2009 in a recent report that the rise in positive drug screens for opiates or prescription pain medicines has increased 18% in that time period, and over the past...
Give us a little perspective. 18% in this field is a lot.
It's significant.
I mean, it's a lot.
And that's in 1 year, and over the past 5 years, it's been a 40% increase in positive drug tests.
People out there will say that doctors out there, and the influence of pharmaceutical companies, that they're perhaps giving these prescriptions for people who maybe don't necessarily need them, that it's about the profit. How do you address that controversy? Well, are people being overprescribed with these medications when they don't necessarily need it?
Well, don't be mistaken. The use of opiate pain medications, there's definitely a role in society for treatment of pain, post-operatively, intraoperatively, for cancer pain. But there's a lot of opiate medication out there now, and it's very simple to go in and say, I have a pain, and get prescribed. So I think part of the problem is lack of education on the part of the doctors, and them not educating their patients about the potential risks and side effects. So, and the problem with opiate medications is while they do relieve pain, some of the side effects is that it can produce euphoria, it can decrease anxiety short term, people with ADD may find they function better. So it's being used more and more, and they're more available. So oftentimes someone will get a hold of them and use them when they're not prescribed, and there's significant risk of using it for other than prescribed.
Yeah, and we're talking about the side effects as well at work specifically. So all these things that you were mentioning right now, if the symptoms appear or the side effects appear when you're at work, you could be putting yourself, you could be putting other people in danger. How do you kind of bypass that? How do you fix that problem, I guess?
Well, you're right. Opiates can affect performance on the one hand, and they can affect safety. They do affect people's ability to pay attention, concentrate. So in somebody in an office setting, performance may go down, but in a workplace where there's operating heavy equipment, it can certainly impair their own safety as well as the safety of those around them.
And different workplaces will, if you're operating heavy machinery, obviously, you're not allowed to continue working if you're under these medications, correct?
Well, that's
an office environment is different than construction zone, for example.
And so there's two issues. One is you have people that are being prescribed prescription medicine and people that are using them non-prescribed. But I think the important thing is in a workplace is to have policies and procedures in place that specifically address the use of prescription and non-prescribed pain medications. Drug screening, pre-employment, random drug screening during, after an accident. Recent reports have shown that the amount of positive drug screens post-accident has gone up dramatically as well. So it shows that they are playing a role in injuries and accidents.
What kind of protection do employees have? Because it is legal to take these drugs and be at work. So, are employees protected to up until what point, I guess?
Well, I think that's where the policies and procedures for the specific employer is really important. Whereas, prescribed medicine in a office setting may be okay, but if you're operating a vehicle or a heavy machinery, so I think it's really specific to the employer, but they need policies and procedures so that they're protected and the employees are protected.
And let's get to some specifics. A lot of people may not even know that they have a problem, may not even know if something's happening when they're at work. So how can you actually recognize the symptoms, the problems? How do we know? We have some info. For example, when an employee realizes that he or she is putting in extra effort to complete simple day-to-day tasks, that should set off some sort of alarm, right?
Right. There's several things. Your productivity can go down. Your ability to finish a project can be affected. People that start showing up to late work or being absent more often. And even for people that at work or other employees to be able to recognize some of the signs and symptoms, changes in behavior, personality changes.
And yeah, that's what you were mentioning. I mean, if your performance starts to become compromised, and then something's wrong, and what should people do at that point?
Well, at that point, it's important to find help.
Yeah.
So to be able to identify the problem, and oftentimes the people using the medication aren't going to be able to identify their own problem. So it's important for family members and those around them, but to be aware of what your treatment options are as well.
Tell me a little bit about, because part of it also, if you start caring less about your work, your coworkers can actually help you spot. If they know the symptoms, they can actually help you spot the problems. Tell me how the Waismann method actually works with these kinds of solutions.
Well, the Waismann method, there's been various ways to get off of pain medication.
Sure.
The problem is that the withdrawal symptoms are so intolerable for people that they'd just rather stay addicted to the medication than pursue treatment. The way the Waismann method is, it's a medical procedure done in a full-service hospital. We bring the patients in, we full history and physical, we pre-medicate them with medications that block the withdrawal symptoms, and then while they're under sedation, I give them a medication that actually precipitates or accelerates the withdrawal. So typical withdrawal can take 7 to 14 days, and it can be really miserable. In the Waismann method, we give patients IV sedation, like we would have for a regular medical procedure, like a colonoscopy, and then give them medication that actually makes them withdraw while they're asleep. So it's very effective, it's safe, it's humane, and
quickly, has the success rate improved with the added help over the years?
Well, for general across-the-board detox, it's probably about 15% a year. For the Waismann method, because of its safe, humane, tolerable effect, we have a 75% success rate for prescription medications at 1 year, which is very successful. And then people can identify what their issues are and treat them appropriately.
Well, great. What a topic. Great. We could talk for hours probably on this, Doctor. For more information on the Waismann method and also addiction, you can go to our website, fox5sandiego.com, and we have a lot more information there for you. Doctor, thank you for your time this morning.
Thank you very much.
Shali?
All right. Thanks so much, gentlemen. Well, outrageous sick calls coming up. Hear the strangest excuses for calling in sick. That story's